don't.
That video is from TikTok and about eating disorders. Eating disorders. Have any one of you listened and been concerned about one of the most common mental illnesses in our life? Before we go through to this topic, please let me introduce myself. My name is Putri Tashakisna Carol. I am from MC1101A class. I am so excited to share some information about our subject, eating disorders among teenage females. Why teenage females? Why did not teenage men? So females, teenagers mostly experience this illness. Eating disorder affects 30 million people. Most of the people who are affected are women, teenagers, and also girls. But 10 to 50% of those who are affected are men. Eating disorders have been around for a long time, but they are getting worse and affecting more and more people. But some of you have known about this and some have not. So eating disorders are serious mental and physical illnesses that cause people to have unhealthy relationship with food, eating, exercise, and how they look. There are many eating disorder diagnoses, but the three most commonly here are anorexia nervosa, bulimia nervosa, and binge eating disorder. Before I go through the meaning of it, I would like to say one fact. Actually, many people think that eating disorders are something people choose and do to get attention. Sometimes, people who that is suffering with these illnesses are afraid to seek out help. It is because of these judgmental people that do not know and lack knowing about mental health, which is about eating disorders. Okay, ladies and gentlemen, what is anorexia nervosa? People with anorexia are picky about what they eat and about how much they eat. They may almost always be thinking about food and calories. They will eat very little, causing them look so thin. They also strongly fear getting fat and don't want to look fat. They will have a twisted view of their bodies and think they are overweight even when they are very, very thin. This is, we call it anorexia. Next is bulimia nervosa. People who suffer with bulimia will eat much more than most would in a set amount of time. And then they will feel so much guilty for getting full. If someone binges and then start throwing a lot, it could be a sign of bulimia. But people with bulimia can be thin, average weight, or overweight. This is different from people with anorexia, who are very, very thin. People with bulimia often hide what they eat and how much they throw up from other people. After they eat a lot, they will purge and feeling relief after that. Lastly is about binge eating disorders. People who have binge eating disorders often eat faster than most people. They might eat alone so no one can see how much they eat. People with binge eating disorders don't make themselves throw up, use pill or work out a lot to make up for binge eating like do people with bulimia do. If a person binges 3 times a week for 3 months, it could signify a binge eating disorder. They will eat large amount of food even when they are not even hungry. They also may feel upset or guilty after binge eating. Besides all of this information, I also have some way to help our loved ones who are suffering with these illnesses. Firstly, we need to express our support and validation. For instance, like you need to tell your loved one that you are care about them and are always open to talking with them. Secondly, help them associate with food, and please don't push them. Try to bring them to a restaurant that they love. And for example, if they love to eat Western food, ask them to accompany you to eat there. But please don't push them to finish their food. But ask them why If you have any problem, just tell me. I'm here for you. The last way is to seek therapy for your loved ones. And please find a therapist that specializes in eating disorder, because therapists that not specialize in eating disorder will do more damage in their process to get out with this illness. The easiest way is to give them full support and always have concern with them. If you have seen your family members having this kind of symptom, please help them and please ask them. My best friend has experiencing bulimia nervosa, and I am so glad that she told me this. Why am I so glad? It is because she has a desire to tell her problem for me. At first, I was in blank mind and asked myself why I did not notice it early. I feel so sorry for her, and now she's getting better. It really takes time, but they will be more excited to go through these illnesses once we support them. My last word, our food is not an enemy. Thank you for listening to my speech today. I hope what I share helps everyone go through these illnesses. Assalamualaikum.